Across the world, at least 2 billion people consume fecally contaminated water. This represents one of the main global health issues. In the rural Mexican region of the Chiapas highlands, this problem is greater, mainly due to the lack of access to basic services of potable water and sanitation, which results in gastrointestinal diseases and malnutrition that largely affect women and children, who on top of that are responsible for the water supply for their families. In order to address these inequalities, we need creative, diverse, and sustainable solutions involving the greatest number of stakeholders at all stages. With its extensive experience working for more than 10 years in the region, Cántaro Azul has implemented a household water treatment and safe storage system intended for rural communities which have electrical service in place, but which do not have water distribution system, hence a dependence on multiple sources for their water supply. In order to implement this solution, we chose Chimix, a community in the municipality of Chenaló, where the inhabitants are Tzotzil Mayans, primarily coffee growers. Even if there is enough water for all of the community's inhabitants, the inequality remains huge due to the absence of a distribution system. This technology intends to supply at least 50 liters daily of safe drinking water per person, thus avoiding post-treatment storage in order to reduce the risk of recontamination. A novel point of entry system, this system centralizes the household water treatment and distributes it through pipes and taps to key points within the household and where water is used directly. The point of entry system consists of a tank which can be filled with water from multiple sources, such as springs, wells, or rainwater, a pre-treatment filtration stage followed by disinfection with ultraviolet light, and a second tank for storing 250 liters of treated water, which is then distributed through pipes and taps inside the household so that it can be used wherever and whenever it is needed. In order for this solution to be sustainable, it is of the utmost importance to involve the largest possible number of stakeholders in all stages of the process. When the systems were installed, the families in the area received training about its use and basic maintenance, and were informed about the quality of the water they were using for their consumption before and after the installation. Furthermore, 4 people from the community were hired as community technicians in order to install and provide adequate system maintenance. In addition, multiple meetings were held with the authorities and the community assembly during several key moments. With the aim of evaluating the project's impact, a stepped wedge randomized trial was conducted, during which we carried out interviews, observations, and water quality tests, as well as children's growth measurements. We also organized women's focus groups and follow-up visits to keep track of the system's condition and provide maintenance. We also took into consideration the intervention's impact on a social, cultural, and organizational level. To conduct a thorough study with these factors in such a context was quite challenging. It required a deep understanding of the dynamics and social structures, so that we could design methodologies and tools which would allow for the gathering of information to reflect a scenario as close as possible to real-world outcomes. Among the principal findings, we learned that water quality improved significantly, and that families reported that they were happy with the changes it has brought to their lives. In order to achieve this, it was essential to be a member of Safewater, an international interdisciplinary project with the aim of producing knowledge and strengthening capacities that contribute to improving the technological and social solutions in order to ensure access to water in rural communities across the world. For Cántaro Azul, this project meant a step forward towards its goal of contributing to the full realization of human rights to water and sanitation in Mexico's rural areas.